a man's hormones get out of whack, they lose their luster. From sex drive to body image, things can go downhill. Here with how a healthy sex drive plays a role in men's overall well-being is functional medicine expert Dr. Cathleen Gerenger. Dr. Kathleen, it's always so great to see you.
It's great to see you today, Gail.
So whenever we think of hormones, you think of women. And yes, our hormones are far more complex than a man's would be, but still it's very important, especially when it comes to testosterone.
Yes, especially testosterone and the male hormone. But male are really simple creatures. As long as those testosterone levels are up to par, everything functions pretty well for them.
Yeah, they're lucky that way. So how do you get a man's body in balance, and when does this decline start to happen in testosterone?
Believe it or not, testosterone starts declining by the age of 20. I've done so many blood work on age groups from the 20s all the way up to the 80s. And what we notice is that there's a gradual decline in these testosterone in a younger age male. And I'm like, what's going on? Everybody wants that magic bullet, that magic pill, that magic one-step process. And I was like, no, it's multifactorial.
Oh, it is?
Yes, it is.
How so?
There's environmental, foods that we eat, and plus the stress levels that they're encountering on a regular basis.
Okay, so you first go over a man's blood results.
Yes.
And then what types of treatment options are available for them?
With the test results, the range is so wide. It can be from 195 all the way to 1,000. Usually optimal levels of testosterone should be 800 to 1,000, the higher range. And when we talk about testosterone in men, it's not just for sex drive. It's more for the cognitive function, the muscle mass, and actually testosterone is needed to produce red blood cell.
Oh, I did not realize that. So what are some warning signs of a man watching, or the woman that loves him watching right now? What should men be on the lookout for that could be a red flag that they're dealing with testosterone issues?
Number one, their wives or their significant other pulls them in and say, hey, this is what's happening. Low libido is one of the main reasons, and the other one is the low energy, loss of motivation, anxiety, depression, lack of focus, unable to get into that deep sleep.
Okay, very, very interesting. So now, is this treated with like pellets, creams, vitamins? How does it work?
It depends on the age group. If they're like in their 20s and 30s, we know that what we need to do is supplement them, teach them healthy eating habits, to decrease the processed food, really control their sleep patterns. Sometimes their sleep pattern actually disturbs their body's ability to repair and make the testosterone that's needed. If they're in their age of like 30 and 40 to 50 age group, what we want to do is that we might introduce them to bioidentical hormones. There's different forms of testosterone. There's the cream where they can apply on their body every single day. The next one is the pellet therapy, where an incision of the testosterone that's injected into the body, and it's really nice and leveled out. And then there's the injectable route, where they have to inject themselves intramuscular.
All right, very interesting. Any other health concerns that men should be thinking about?
Yes, I would say that definitely get into a regular sleep pattern and avoid the processed food, and add in, before you take out, add in healthy foods like fatty fish, like salmon, wild-caught salmon, avocados, seeds. And when I was younger, I didn't know what was happening, but my mom makes these deer antler. So she goes and she buys these deer antlers somewhere from Canada, and she wraps it in this cloth, and she actually marinates in this white wine thingy, and for months and months. And in the winter, she'll pull it out, and then she'll shave it and create little meatballs. Deer antler actually is the onset of what we call IGF-1. So it's the onset of the testosterone pathway.
Isn't that interesting?
It's really interesting.
What a wise mother that you had, that she would even know to do this.
Exactly, with no medical background.
I love it, I love it. Well, Dr. Kathleen, as always, we so appreciate you coming on Bloom.
Thank you so much.
You bet, you bet. We're going to post Dr. Kathleen's story online at Bloom.